In this practice, you'll need a sturdy, stable chair with a straight back, no arms. Make sure the chair does not wobble, roll, or slip. Definitely no wheels. The seat should be flat, firm, and parallel to the floor, with enough space for your sit bones to rest comfortably. Choose a seat height that allows your feet to rest flat on the floor, with your knees bended at about a 90-degree angle and your thighs roughly parallel to the floor.
Hello everyone, welcome. My name is Hai Ying. Today's session will be focusing on sit bones using some dynamic sitting exercise. When we sit on sit bones, it will help to maintain a better posture, reduce fatigue, and perhaps reduce some of the discomfort of your body. Let's start. Let's move to the front edge of your sit. Let's take an inhale together. And exhale, squeeze all the air out of your body. One more time, inhale. Exhale. Okay, let's lean our body to the right side. Shift your weight to the right buttocks. And then shift your weight to the left buttocks. Just to feel there are some bony sections underneath our buttocks. And feel free to pull the butt muscles out so maybe you can feel the bony section better. And then next time, let's lean forward slightly and then coming back and pass it. So you may feel your sit bones this way. And then one more way to feel is using our hand. So let's put our right hand underneath our right buttocks. And you move forward, backward, left and right. And you will feel a smooth, like rock underneath your butt. So that's your right sit bone. Let's change side. Use your left hand underneath your left butt and move your body front and back and side to side and find that slippery, smooth surface of the bone. Okay. Let's pause and feel, can we balance our torso on the two sit bones? Or just feel if the pressure on one sit bone is different from the other one. If so, can we shift the weight a little bit to even it out? Next exercise, we're going to find the neutral pelvis. So I'm going to turn 90 degrees and you can see me better. First, let's find the sit bone, sit tall. And then just imagine at the end of your tailbone, there is a light. And first, we want to shine the light to the back of the seat. Okay, so I just use my hand to make an analogy. So let's shift, maybe weight forward. And lift your tail slightly so it's pointing to the back. Now we want the light to shine under our seat, directly toward our seat. So I will probably lift my torso back straight up, and then the light is underneath. Okay, let's repeat a couple more times. Inhale, light shining toward the back. Exhale, tail move in. Inhale, light shine back. Exhale, Maybe engage your lower belly a little bit to pull the tailbone in and underneath. One more time. Inhale and exhale, passing the tailbone. Okay, let's sit. Can we sit easier, finding the sit bone better? And in theory, usually when we sit on sit bones and sit in neutral pelvic, then that helps our sitting posture. So let's pause and feel. Okay, let's go to the third exercise. Hands comfortably on your thighs. Let's take an inhale. Exhale, tilt your head to the right. Right ear to right shoulder, just a little bit tilt. And come back. Right ear to right shoulder. Back to neutral. Right ear to right shoulder. Back to neutral. Right ear to right shoulder. Back. One more time. Right ear to right shoulder. And back. Pause. Just feel the, and if there is any difference in your body, left and right side, or your sit bone, or your belly, or your back. Okay, next time we're gonna tilt our shoulders to the right, just a little bit. Take an inhale, exhale, right shoulder down. Inhale back, exhale down. Inhale back, exhale down. Inhale back, down, back. One more time, down and back. Pause. Okay, next, let's try to lift our right sit bone, the right side. Inhale, lift. Exhale, down. Inhale, lift. Exhale, down. So this is one way to lift. There's another way. Instead of lean our body toward the left side, we can also C-shape our spine like this. So basically, I feel contract on my right side and I feel extension on my left side. Let's try this way, the C shape. 1, 2, 3, 4. You don't have to lift very high, just a little bit. Okay, let's pause. And next, we're gonna combine all these movements together. So while we lift our right sit bone, we are gonna tilt our head and our shoulder all toward the right side. So let's try. Take an inhale, prep, exhale, tilt your head, your shoulder, and lift your right sit bone. Release. Exhale. Inhale, release. Exhale. Inhale, release. 2 more times. Inhale, release. And you may find yourself, while C-shape your spine, you may likely to engage your core a little bit, pulling the belly button toward your spine. Okay, let's pause. Take a quick scan of the body, left and right side. Let's exercise on the left side. Inhale, prep. Exhale, tilt your left ear to your left shoulder. Back. Exhale, tilt. Back. Exhale, tilt. Back. 2 more times. Number 4. Back. Number 5. And back. Let's pause. Feel any effects of the movements we've done so far. Okay, next, let's tilt our shoulder, left shoulder down. Take an inhale, prep. Exhale, left shoulder down. Back. Exhale, left shoulder down. Back. Left shoulder down. You may find your head tilt a little bit too. That's normal. I sometimes cannot control it myself either. Okay. And the last time, left shoulder down. Back to neutral. Pause. Take a quick scan of your body. Next, let's use the C-shape technique to lift our left sit bone high a little bit. Inhale, lift. Exhale, down. Inhale, lift. Exhale, down. Inhale, lift. Exhale, down. Inhale, lift. Exhale, down. I think there's one more time. Let's do it. Inhale, lift. Exhale, down. Okay, let's combine the 3 exercises on the left side all together. When we C-shape, we drop our head and our shoulder to the left side. So let's take inhale, prep. Exhale, C-shape. Back to neutral, inhale. C-shape. When you do the C-shape, you may want to engage your belly slightly in. Pull the belly button in a little bit. C-shape. Make sure your foot is all flat on the surface. You didn't lift up your heel. If your left heel is lifted up, reduce the range of motion. Okay. Let's sit. Just trying to feel the left side and the right side, especially around the sit bone area, the left sit bone and the right sit bone. Can you feel any difference? Maybe you sit a little bit easier, feel like. Okay, let's alternate C-shape with all the movements together. And let's try to have both of the feet pressed into the floor when we do the alternative. Okay, so let's start from the right side. Take an inhale, prep. Exhale, C-shape to the right. Press into the right heel slightly so the foot is flat. Inhale, come back. Exhale, left side. Press into the left heel and the left foot a little bit. Come back. Exhale, right side. Come back. Exhale, left side. Pull the belly in slightly. Come back. Right side. Back. And left side. Back. One more time, right side. Squeeze your right waist. Back. And left side, you may feel your left waist side is a little bit squeezed. That's normal. Back. Okay, let's do some sit bone walk. So how we do that? Let's lift our right sit bone first and shift it forward. And then Lean to the right sit bone and lift the left sit bone and shift the left sit bone forward. Alternate on your chair. Okay, once you get to the edge, very edge of the chair, let's reverse. Back pedal. Lift and shift back. Lift, shift back. Lift and shift back. Move forward again. So make sure the entire process, both of your feet is flat on the ground. And you may feel you have to engage your oblique muscle a little bit. That's normal. And reverse. And you may also feel you need to use your core muscle a little bit to stabilize. And that is normal. Okay, one more round. Wherever you are, you may hear my chair squeaking. That's all right, as long as it's stable. Okay, let's pause. Feel the difference and effects. Maybe you can sit taller, easier. I do hope so. Thank you for joining me. We'll see you next time.